Okay. Thanks so much for coming. We're in the perfect room for an event about the history of the college. And I want to just thank the village, also known as the College of Human Ecology, that pitched in to bring this event to fruition. It's been a great team effort. So I'm really pleased that we can be here together to celebrate the history of the College of Human Ecology. This is an annual event in honor of and opportunity for the annual fellow, to share the research that's been done. And I'm pleased to introduce our 2025 fellow. Tara Pearson is the 2025 Dean's Archival Research Summer Graduate Fellow. And as a Ph.D. student in the graduate field of design and environmental analysis and in the Department of Human-Centered Design, Tara explores the potential for design to positively impact emotional experience and to bolster well-being. Her current research examines the role of visual aesthetics in eliciting experiences of delight in our environment. And Tara has a really remarkable educational background in both public health and in architectural design. And her perspective and the research that you'll hear about today clearly draws on that background. She earned a Master of Science degree in biohazardous threat agents and emerging infectious disease from Georgetown, and then subsequently a Master of Architecture degree from Syracuse University. Tara has taught architectural design studios, coursework in graphic design, and in 2022, she launched a course that she created exploring disease-driven architectural innovation throughout history, including the COVID-19 pandemic. And that was during her time at Syracuse University. Alongside her design research focus, Tara continues to pursue her long-term interests in the histories of human resilience and innovation in the face of pathogenic threats, and how these histories relate to modern-day beliefs, policies, and practices. As the 2025 College of Human Ecology Dean's Archival Research Fellow, she's followed that thread deep into the archives, exploring some of the college's earliest moments in community-engaged research and curriculum development between 1900 and 1920. Please join me in welcoming Tara.
Thank you so much for that introduction. I'm Tara. Thank you all for being here. So before I begin, I'd like to express my gratitude to the Dean and the College of Human Ecology for supporting this project, to the Rare and Manuscript Archives for stewarding such an incredible collection, to Professor Nancy Wells for her guidance in the earliest days of this research through this presentation, and to my advisor, Professor So-Yeon Yoon, for her support and her patience for letting me take on this passion project. So what inspired this project? Well, if you look at the image in the upper left, you'll see a map of measles cases across the United States as of the last week. On the bottom right, you'll see measles cases by year since 2025. As you can see, we've had a pretty sharp rise. In the upper right, you'll see a headline from an FDA outbreak investigation involving E. coli in raw cheddar cheese. These are just some of the diseases we have the tools to prevent, and yet here we are. We're living through a moment of rising misinformation and growing distrust of science and academic institutions. But rather than debate about where we are now, I wanted to go back and look at where we, the College of Human Ecology, came from. Cornell's College of Agriculture was already working directly with farmers across the state. But how did the university begin extending that same partnership to women? How did it look when an institution asked rural women what they most needed to know, and then got them that information in a way that they could reasonably put to use? I had a feeling that there was more to Martha Van Rensselaer's story than just helping women create efficiency in their homes. Not that that wasn't awesome. So she knew these women's struggles and the deep losses that they faced when their family members, their babies, died from these diseases. She also knew that they were intelligent and incredibly capable. So the story you'll hear today is about how she approached supporting rural women with up-to-date scientific information delivered in a clear, approachable, and practical way that they could put to use, all in an era when society had thrust upon them the very heavy responsibility of family health, And so here we go. Now let's jump into the research questions that underpin this presentation. So we'll move forward through this timeline from here. So you'll see this pop up a few more times. In approaching this project, I had three main research questions. So first, what kinds of science-based information, about disease prevention was part of the earliest home economics curriculum, and how did it evolve? How was this information translated into practical guidance for rural communities? And third, how was this curriculum employed for in-person courses once the Department of Home Economics was officially established in 1907? So to answer these questions, I spent this past summer and much of the fall reviewing original source material from the college's collection in the Rare and Manuscripts Archive. So the material includes the Farmers' Wives Reading Course Bulletins, course lists from the College of Agriculture's winter courses and the regular academic year offerings from 1900 to 1920, correspondence between faculty and staff, and even the women participating in the reading courses themselves. These materials offered insight into Van Rensselaer's intent for including scientific sanitation lessons, both in the reading course and in academic courses on campus. So now I'd really like to set the stage with a quote from Van Rensselaer as she relayed it to her co-director, Flora Rose. She wanted to learn about the bacteriology of the dishcloth so she could explain to farm women the importance of its cleanliness. She wanted them to understand the why that they needed to know rather than just being told to blindly follow instructions. And so look at what she was up against. When she approached a bacteriology professor at Cornell for his help, who she was kind enough to leave unnamed, his response was just teach them to keep it clean because it's nicer that way. So as you'll see, Van Rensselaer clearly ignored that advice. So now let's take a look at the context, or the disease landscape these women were all living in. To paint a picture of disease prevalence in 1900, I've zoomed in on a portion of a bulletin that New York's Board of Health published in April of that year. I've highlighted typhoid and tuberculosis. These are two diseases that we're going to see referenced again and again. You may notice several diseases that are now preventable that are popping up again today, measles and whooping cough among them. I've circled zoonotic diseases there at the top to illustrate where scientific knowledge was about disease at that time. So this was a major period of transition. The term zymotic comes from an older theory relating to disease being brought on by fermentation. This was a bridge between miasma theory, which blamed disease on bad odors and bad air, and then germ theory, which identified specific microorganisms as the cause of disease. So in 1900, there actually was still quite a bit of resistance to germ theory. This list gives you a sense of where prevention and treatment stood for each of these diseases. So notice how sanitation appears in blue. Meningitis, typhoid, malaria, scarlet fever, measles, whooping cough. For most of these diseases, sanitation and hygiene measures were the primary line of defense. Smallpox is actually a really notable exception. So there was a vaccine available since the 1870s, and New York actually made it compulsory for their public schools in 1893. That was a really big deal. But for others, the tools were very limited. Technically, typhoid had a vaccine by 1896, but this was mostly used by military personnel in Europe and wasn't widespread used in the US. They really focused more on sanitation practices. But our Army did eventually take advantage of it during the First World War, which was pretty impactful. But in 1900, sanitation and hygiene measures were the primary way to protect your family. So tuberculosis was also known as consumption or phthisis, if I'm even saying that right. It was devastating. In the 1880s, it killed 1 in 7 people in the US and Europe. The bacterium that causes it was discovered in 1882, finally proving that tuberculosis wasn't hereditary, which was one of the kind of widespread beliefs at the time. Unfortunately, antibiotic treatment didn't show up until like the 1940s. So TB was spread primarily through the air, person to person, but it could be transmitted through contaminated milk from cattle that were infected with bovine tuberculosis, because we can get bovine tuberculosis. So this was a huge concern for families, especially those with children, because milk was a major food staple at the time. As for typhoid, it was well known at that time that contaminated water supplies could cause typhoid fever. In fact, the 1903 outbreak right here in Ithaca was one of the last major water contamination-related outbreaks in the United States, and it could have been prevented. So about 1,300 people were sickened. That's roughly 1 in 10 residents. At least 85 people died, including 29 Cornell students. Prior to the outbreak, the private water company had refused to invest in water purification systems, which led directly to contaminated water reaching the public. After the epidemic, I'm glad to say that Ithaca's water became publicly controlled. So this is a really great, although pretty sad, lesson in why critical services really should not be left entirely to private interests. In cities, standardized sewage and waste disposal, clean drinking water, modern plumbing fixtures, these were becoming more and more common. But rural farm homes, regardless of wealth, they were usually a different matter. So clean drinking water wasn't guaranteed. Poor drainage and faulty plumbing, that often led to contaminated drinking water supplies. Unhygienic practices like shared public drinking cups, lack of hand washing, unsterilized food containers, it was widespread. As you can imagine, the conditions were ripe for typhoid, which was spread through contaminated water or food and drink products, and also by flies that would pick up bacteria from open outhouses and animal waste around the farms and carry that directly to people's food. So that was the world Martha Van Rensselaer was living in when she stepped onto Cornell's campus in 1900. But who was she? Well, Van Rensselaer was an educator through and through, and you can see her background or much of it on the slide. But the thing I want to draw your attention to was this. In 1894, she was elected commissioner for the Cattaraugus County, the school commissioner for Cattaraugus County. So that position, which was a 6-year term, put her in direct contact with rural communities across Western New York. And so this gave her the chance to get to know rural women and their issues very well. So by the time she connected with Cornell's Liberty Hyde Bailey in 1900, she already knew she wanted to serve these women. Bailey, a professor and later the dean of the College of Agriculture, he had already seen the success of the farmers reading course. This was like the men's version. And he noticed a similar need for rural women. And he wanted to create a parallel course for farmers' wives. And so Van Rensselaer, she had come highly recommended by one of his colleagues. The image on the right is a draft of the letter that Bailey sent to farmers' wives, which was included in an issue of the farmers reading course. So he invites them to participate, and he's kind of surprisingly frank about it. So listen to how Bailey frames this. He writes, "Of 100 widows with a family of children and a farm, we are sure a larger percentage will make a success in the single-handed struggle than with the same number of widowers in the same condition." He's saying that widows would handle the farm and kids better than a widower. That's pretty frank, but he's really acknowledging how capable and important farm women are. And then he says this, "We must ask you to help us to help you. We want you, each of you, to talk back, even though you feel called upon to tell us that we're wrong." So he's asking for their feedback and partnership. And he shares that the first issue will be on housewife steps, but he reiterates that he wants women to write in and tell them what they're most interested in hearing. So with that, let's jump into what types of information and advice were covered in the sanitation focus bulletins throughout the reading course. So having reviewed many bulletins, I noticed that sanitation measures made their way into a ton of the publications. So this timeline highlights the issues that contain some level of sanitation focus. It's nowhere near the number of actual publications that they put out. But the ones in the darkest blue, these ones are directly about sanitation, and they're primarily written by Van Rensselaer. This medium blue over here, these are written by other faculty and guest authors that are part of the industries. And then the lightest blue shows the second editions and the later revisions, and some of those are things we'll talk about today. The blue to the green color, that marks where sanitation was mentioned, but it wasn't really the main focus. And then that blue to magenta gradient represents in-person courses, and many of those did include sanitation content. So you'll see this timeline pop up again and again between each set of bulletins to kind of track where we are. So one of the things that struck me in the archives was the evidence of how actively Van Rensselaer sought input before writing the bulletins. And so this letter is just one example. So shortly after the first issue was published, that was Saving Steps, she reached out to the Federation of Women's Literary and Educational Organizations, which was a network that she was connected with through her work in Western New York. She's letting them know that home sanitation, the next bulletin, is in preparation. But more importantly, she is asking them to discuss the topic in their clubs and to send their thoughts on the most important issues and how difficulties might be remedied. She specifies that this will be about rural problems, drainage, water supply, cellars, and dust, and not about city infrastructure. She's designing this for her audience along with her audience. So once Home Sanitation was ready to publish, it was advertised. This is actually a printer's proof of an ad that was included in the Farmer's Reading course, introducing the second issue of the Farmer's Wives Reading course. The language is actually pretty telling, and it's also charming. So it acknowledges that securing healthy sanitation conditions is much more difficult in the country, where sewers are unknown and where the plumber, some will say happily, has not entered. So there's a warmth to that. They're like chuckling along with their readers. They're not lecturing them. And then it pivots to practicality. It says, this little pamphlet sets forth many simple ways to improve the comforts and healthfulness of the home. So that's how it was teased, with warmth and practicality, maybe even a little wink. Home Sanitation went through 3 editions. So Van Rensselaer revised it each time to reflect new scientific understanding that she was getting. So you're looking at all 3 here. This is April 1901, December 1901, and then November 1904. But before I walk you through the specific changes, it's worth understanding how this bulletin works. This isn't a list of instructions and advice. This is a story. Van Rensselaer creates a fictional farm family, the James family, and she walks the reader through their unsanitary living conditions, the damp cellar, the polluted well, the contaminated brook that's bringing water to their farm. She peppers in consequences. 4 of the James children have died, 2 as infants, 2 as teenagers from a fever. She's really tugging at their heartstrings, but she's doing it because these losses were really common. These were things that her readers would have seen themselves in to some degree. And then it takes a nice upward turn. The family's college-educated son comes home and helps them transform their farm. They change up the drainage, they drill a new well, they do some water testing, they create ventilation throughout their cellar and throughout the entire house. The cleanliness is completely transformed. So throughout, though, she's incredibly respectful. She goes out of her way to say this isn't meant to reflect on anyone's way of living. This is just suggestive of conditions that may exist in some homes. She was very careful. She knew her readers might be a little defensive or a little embarrassed, and so she really met that head on with kindness. So now I'm going to walk you through some of the key changes between editions. So the tables that I'm going to present throughout the presentation track every disease and germ-related change that I came across when reading through the bulletins. So as you can see, there were many. So I'm just going to highlight just a couple of examples that stood out to me. So if you look at the row here for scarlet fever and typhoid, in the April 1901 edition, a village outbreak transmitted through a contaminated brook is attributed to scarlet fever. The thing is, scarlet fever is spread from person to person through respiratory droplets. It doesn't really have anything to do with contaminated water. But by December 1901, she's changed this. She corrects it to a more epidemiologically accurate waterborne disease. So she could have chosen this, she could have chosen cholera, but this was pretty prevalent at the time. And that stays, of course, in the 1904 version. So now if we look at the row beneath that, the term miasma, referring to that old belief about disease being caused by bad air, that gets replaced in December 1901 with malaria and mosquitoes. And so that was reflecting the state of vector-borne disease in science at the time. This table, of course, continues. So a couple of quick changes here. I'd like to draw your attention to the row with flies and manure. This was something that was entirely new in 1904. And so this is, again, reflecting on that new information about insects as disease vectors. They didn't realize flies were, coming in and grossing up their food. But when she found out, she added it. She also brings in a reference to the school water supply. So I'd mentioned that she said, oh, the contaminated brook, it brings water to the family farm. Well, she extends that narrative to, oh, by the way, the local school is also getting their water from that, and it's coming through your farm. So she's broadening the scope of household sanitation all the way into community infrastructure and community responsibility. And then finally, in the last row, she mentions the water closet. And so she notes that a future bulletin will discuss it. She's probably referring to one that pops up a little bit later, actually as far out as 1912, called Rules for Cleaning, which is when bathrooms in the home became much more common in farm homes. Not everyone had them. So those were the home sanitation bulletins. And now we're going to move on to her germ life bulletins, which is sort of a companion piece. So the first talk for germ life in the farm home was published in December 1903, and this was shortly after the Ithaca epidemic waned. A second talk on sanitation came in December 1904. These bulletins mark a major shift in how Van Rensselaer was presenting her material. She totally drops the Farmer James narrative, and she presents bacteriology much more directly. She defines bacteria, she explains transmission pathways, and she teaches disinfection methods. So just to highlight a few, the 1904 edition introduces the carrier state for diphtheria. This is a really sophisticated concept for the time. So it describes people who were asymptomatic or, as she writes, apparently recovered, but still carry the bacilli in their throats, transmitting the disease by coughing or sneezing into milk. The concept of asymptomatic transmission wouldn't become widely known public knowledge until that famous case of Typhoid Mary. And that didn't happen for another 4 years. So then scarlet fever and measles, the 1904 edition, it draws a new distinction, actually. It separates known bacteria like tuberculosis and typhoid from a disease that it calls virus. So in 1904, virus didn't mean virus as the category we know it as today. It actually meant like an infectious agent of unknown origin. But what's interesting about it is they're starting to realize at this point, like, oh, okay, so there's lots of different kinds of microorganisms and different ones cause disease. So let's start differentiating. On the second part of this table, there's also an update to things like the lower bounds for pasteurization. So of course, milk was a very important thing to focus on at the time, and they wanted to make sure that they were giving them accurate info on how to get the disease out of it. And then in 1903, if we look at the body's immune defenses, if we want to think about what people knew about immunology at the time, so it mentions white cells in the blood carry germs away. That's pretty good, but it's a little vague, right? By 1904, she's teaching readers about leukocytes, blood serum, wound infection, abscess formation, the digestive tract entry as a distinct pathway for disease. That's like a pretty dramatic leap in scientific literacy for a layperson at the time. So by the end of 1904, Van Rensselaer has built this foundation for her readers in sanitation. But she doesn't stop there. The next set of bulletins pushed this even further into practical application. One issue that kept surfacing across bulletins and was a major and ongoing public health crisis in its own right was impure milk. Milk sellers were contaminating their own product with unsanitary practices and even purposefully adulterating it with fillers to increase volume. So for infants and children whose primary food was milk, this wasn't just disgusting. This was often very deadly. So this issue is tackled quite directly in the 1905 Dust is Related to Food Bulletin. It brings together 3 authors, each having a distinct approach. So Maria Elliott, a household bacteriologist from Boston, handles the microbiology. Professor Raymond Pearson from Cornell's Dairy Industry Department contributes experimental data for consideration. And Van Rensselaer writes a closing editorial connecting all of these things to daily life. So each takes a very different approach to making the science accessible, but that's something we're going to put a pin in and dig into a little bit later. A few years later, so this is where Dust and Related to Food is. A few years later, 1909, Van Rensselaer publishes a new educational resource, The Bacteriology of the Household. This new publication replicates a lot of content from both the Germ Life series and the Dust is Related to Milk bulletin. But she does do a lot of reorganization. She expands the content. She tightens the language up a bit. She adds info on harmful and beneficial bacteria, food preservatives, and then tips for practical application. But instead of doing another table, I thought I'd just share with you the expanded list of practical applications and tips from the 1913 version. So this includes things like discussions surrounding coughing and sneezing etiquette, kissing as a potentially hazardous practice, especially around babies. And she even discusses the care of toilets, which had become much more common by 1913. This is my favorite quote, so I'm just going to read the quote. For coughing and sneezing in the open, there is no excuse. A handkerchief should be within easy reach to catch the offending spray from the mouth and nostrils. The truth of this statement is an argument for a pocket in a woman's dress in which to keep the handkerchief. So we have been asking for pockets in dresses for a long time. So we've been moving pretty quickly through a lot of this content. So much of this was left on the cutting room floor here. Regardless, we've gotten a taste of what was included in the bulletins and how it changed over time. But now I want to turn our attention to answering that second research question, which was how that science was actually communicated to the public. And this is where I'm going to bring back that 1905 Dust is Related to Food bulletin. There's 3 different approaches that give the readers a way to connect to bacteriology. So Eliot maps the unfamiliar onto the familiar. She takes microbiology and frames it through gardening and bread making. Pearson converts abstract risk into numbers for comparison. He walks readers through experiments with specific bacteria counts that they can visualize. And Van Rensselaer embeds scientific principles in scenarios from daily life. She really makes it very personal. And honestly, some of them are pretty funny. So who was Maria Eliot? Well, she was a pioneering household bacteriologist who trained under Ellen Swallow Richards in Boston. And so Richards, as many of you may know, is widely recognized as one of the founders of home economics and a leader in sanitation science at MIT. Eliot developed a correspondence course in both household bacteriology and household hygiene, and it was distributed by the American School of Home Economics. These courses are notable because they taught women to make homemade plate cultures to detect germs and assess the potential infectious disease risk in their own home. And so these women were, as we might say today, doing their own research. As you can see from the contents page here of Household Bacteriology, this is Eliot's version. Van Rensselaer would have had to be really selective when drawing from her work because she had to keep it to a much more manageable size. So the bacteriology of the household bulletin that Van Rensselaer produced was 20 pages, and that included space for suggested further reading. She gave them a lot of further resources and some discussion questions. Well, Eliot's course was well over 150 pages, and it includes her references and more detailed test questions. So back to this bulletin. So to translate microbiology into something tangible, she uses an extended garden metaphor throughout. She walks her readers through dust garden experiments. So on the left, you can see the results of one of her experiments. So dust is collected using a dry broom that produced one pattern of colonies there on the left, while the dust collected after using a feather duster produced another pattern of colonies. She's not just telling readers that these tools are like not that great because they scatter dust all over. She's showing them what happens when they use them. But she doesn't treat her readers as unable to understand really complex ideas. As you'll see in this table, this shows the range of topics she covered, from bacterial and mold definitions to distinction between wild cultivated yeasts, to spore formation, to canning hygiene that's like grounded in bacteriology. She gave them so much to work with. And as she's teaching these concepts, she's including concrete prevention methods. So the readers are not only learning these practical tips, they leave understanding why they work, often on a microbial level. Raymond Pearson, no relation, taught in the dairy industry department at the College of Agriculture and was involved with regulating the dairy industry. He was part of the 1906 New York Milk Conference, and he created one of the earliest versions of a scorecard for inspecting dairy-related facilities. And that's in 1905, so the same year that he was writing that bulletin, he was doing this. So Van Rensselaer was pulling in guest authors who were not just academics and her colleagues, but these were people who were actively shaping the industry and public policy. His section takes a more quantitative approach. He establishes baselines for what what milk and stable air would look like. So he gives them something to start with. And then he systematically tests common contamination sources. So pouring between cans, contaminated utensils, cleaning the cow's udder, pail size, fly contamination, just random barn debris. And each one comes with specific numbers that the readers can kind of compare and understand what they mean. This is just one example of his writing. And so he describes placing a 2-inch piece of hay into sterile milk. After shaking it for a minute, it contains a little over 3,000 bacteria per cubic centimeter. After 24 hours at room temperature, over 3.4 million. So he does this for each item tested. His approach is letting those bacterial quantities drive the reader's imagination. And based on the squirming, I can tell it was driving yours too. So that's not to say he didn't, give some practical tips. He said, use larger containers so you don't have to pour between milk vessels, cool the milk in the same vessel, reduce the size of the pail's opening. He even gave them the different surface measures for every size of pail opening so they could understand, like, oh my God, so much could fit in there. And then Van Rensselaer wraps up the bulletin with some, as she does, convincing storytelling, making her points using humor and these relatable situations. So she even extends sanitation concerns beyond the kitchen. And she will include things like the delivery wagon. Are they covering their food? Is it all getting covered in dust when it drives down the road? What's it happening in the market? What's happening with the milkman? She walks people through several of these. This is one of my favorites, and it takes place at a hotel. She describes a hotel guest who watches an employee remove his pipe from his mouth, taste the preserves with a spoon, and then put the spoon back in the dish, and then resume smoking his pipe. And then she notes that the guest was not in a position to remedy the difficulty as she might in her own home. I'm guessing she probably got a pretty good laugh out of her readers, but the interesting thing to me is that they're getting to absorb this lesson about cross-contamination without a single technical term. And so she does that with so many of these stories. It's really an amazing talent that she has. So right now we've looked at things that were just coming through the mail, but I want to show you how some of this content came through when it made its way to the classroom. So here we can see when these courses first came to campus. They were part of the College of Ag's Farm Home group. The first course was called Women's Work and Domestic Science. It didn't really have a background and description. The next year, however, she changes this to Women's Work and Home Economics. And in the description, she states that it covers social conditions, shelter, sanitary equipment, maintenance, food, health, and conservation of strength. So these were offered during the regular academic term. But there were also courses that happened in the winter, which were really great for, people working in agriculture because, they're not doing as much in the farm in the wintertime. And so there would sometimes be courses in the Department of Agriculture's, but eventually home economics got their own winter course, like it was their own section of it. And so this one first happened in 1906 and 1907, and it was split into 3 sub-courses. So we're just going to zoom into one of them. So course 1 included 4 parts, and it was centered around scientific subjects like food and sanitation and cookery. The first part is practical physiology and personal hygiene, and this has a brief discussion of sanitation and food nomenclature. The second part was the scientific side of laundry, which included the chemistry that was involved and notably the necessity of boiling clothes as a means of disinfection in case of contagious disease. Household bacteriology, this was 4 lectures that covered how diseases spread, how to prevent distribution of bacteria, and the role of yeasts and molds. And then not on the screen is foods and cookery was another one that she covered. And then in the year 1907 to 1908, that was when home economics was established as its own separate department in the College of Agriculture. The 1908-1909 course register shows the first set of courses offered by the new Department of Home Economics. So the ones that are highlighted here are those that are mentioning sanitation directly, but this was the entire course list. The foods course actually includes food preparation and adulteration, so we can kind of infer that it covered quite a bit of sanitation practices. And this was also the first year the dairy industry department offered bacteriology of the home. This was offered to home economics students, and it required laboratory bacteriology as a prereq. So home economics didn't have a bacteriology course as part of its like core courses it offered, but it did require most home economics students to take these courses. And then I'm actually really excited to say that we do have some evidence of course content. These two images include an assignment and a course outline from 1916 and 1920 respectively, though I didn't find any earlier materials. So bacteriology of the home was first offered in 1908 to 1909, and it appears to have also gone by the name household bacteriology. So this student, Mary Moore, she was actually the daughter of Varanus A. Moore, who I believe was the dean of the veterinary medical college, who Martha had worked with previously. She took this course in the spring of 1916. And so we can see a table here in the front listing common pathogenic bacteria, along with their habitat and how they multiply, channels of elimination and infection, as well as drawings of many of these bacteria. And in the very back, you can't see it well, but it's a final exam for the course that's kind of peeking out.
Good question.
They were multi-part though. And then health in the home was first offered during the 1920 to 21 academic year, and bacteriology was a prerequisite for the course. So as they do now, they list them here. So you can see pages from its course outline. So right here, we have the first page, and then the student took a ton of notes on the back of the first page. And then this is its second page here. So it covered things like community health, the home as a health unit, air supply, food handling, the adulteration of food. We also see things like topics in public health and rural specific problems. So these represent a university microbiology course being taught to home economics students. And so these were all grounded in the same principles that Van Rensselaer had been translating for farm women since 1901. So just to close, what we've seen today, this is a set of bulletins, just one example of a great partnership between this institution and the community around us. Van Rensselaer respected the intelligence of rural women. She offered the scientific why behind every practical what. And she built a program that treated women as partners in their own education. Instead of just telling women that the dishcloth should be clean because it's nicer that way, she helped them build scientific literacy so they would be well equipped to make daily decisions that had profound consequences for their family and their community. Thank you.